Hi, it's Jane with Serendip PT. Here's a topic that a lot of clients bring up to me: the pooch, that adipose tissue or that fatty tissue that we get below the belly button. Many women want to know how to get rid of that area, how to make that appearance look better. Inside this video, you're going to find out some reasons why we get the pooch and some quick fixes of things that you can do to help to get rid of that. Here we go. The pooch. So the pooch would be that adipose tissue that we women get and men get below the belly. So right under the belly button. Some of the causes of that are genetics. Sometimes people just put on weight in that region. Other causes can be abdominal surgeries, a C-section. That C-section is a huge scar that was put into your tissue to be able to get to the baby, or any kind of abdominal surgery where they had to cut through there. So that has anchored all that tissue down and it's pulling everything toward it. There's no movement in that region. When we have a scar in our body heals that scar by laying down all kinds of collagen and elastin, but it doesn't necessarily lay it down in an organized fashion. So it lays it all down and it gets all haphazard and tight in there. So again, no movement. Normal tissue, your fascial tissue, should have spaces in between. But when this scar tissue lays down, it lays down and there's no space in between. It just wanted to heal the thing. So you can do scar massage in there. You can release the tissue by pressing into it, elongating, friction massage across it, doing some opening diagonally through those scars, and helping to elongate that tissue again, creating space in the fascial tissue. And then the hydration can come back in there, and that scar can start to lay like this again. Doctors will tell you that it takes a year for a scar to remodel, and that's true. And they think that that's all that can happen. In a year, you're done. Nothing else is happening with that scar. That's not true. I have worked on scars, and numerous friends of mine who are myofascial release therapists as well. You can work on scars forever, and they will always remodel and change in their appearance. You can get great relief by doing scar tissue massage. The reason that's important is because if we start to create motion through the scar, some of that adipose tissue doesn't accumulate there anymore. It's not being restricted anymore, and now that appearance can look more smooth there. That makes sense? So one last reason for having that little pooch can be food choices. And there's a whole other series we could do about food choices and foods that are inflaming, and foods that are going to cause your gut to have excess adipose tissue or your gut not to function properly. So having anti-inflammatory foods, decreasing your sugar, your dairy, your wheat, having probiotics added to your diet, prebiotics, all of those can be really great to be able to improve the appearance of our abdomen. Pelvic tilt series is a simple exercise that people can do to help that lower abdominal region. So I mentioned the transverse abdominis muscle before, the TBA, sucking the gut muscle. So if you lay down, and I think a lot of people have done yoga before, you do a pelvic tilt back and forth, which is a rocking of that pelvis. So you do little pelvic tilts. Well, the muscle that enables you to do the pelvic tilt is your rectus abdominis and your transverse abdominis. It's a fabulous exercise and it's super simple to do, but it makes a huge difference if you do quite a bit of pelvic tilts. So I like to do a pelvic tilt series where I have you do 10 pelvic tilts. Then you would hold your pelvic tilt and your knees are bent. Then you might do a little mini march with the knees up and down. And then go back to doing 10 pelvic tilts. So you've done 30 exercises. Do those every day, and that can really help as a fundamental exercise to strengthen your lower abdomen. And that's a great exercise that's going to build and be the foundational aspect for every other exercise that you do for your belly.